The National Electrical Code requires tamper-resistant receptacles in all areas accessible to children. This includes exam rooms in children's health clinics. Children may be present in exam rooms during procedures, examinations, or vaccinations. Tamper-resistant receptacles prevent children from inserting objects into the slots, which could cause electrical shock or other injuries. Some state regulations do not specifically require tamper-resistant receptacles in children's health clinics. These states may consider clinics to be different from residential or educational facilities, where tamper-resistant receptacles are mandatory. In low-traffic areas of the clinic, such as exam rooms, the risk of children tampering with receptacles may be considered minimal. Patient safety is the primary concern and protecting children from electrical hazards. Tamper-resistant receptacles offer an additional layer of safety, regardless of the specific code requirements. Installing tamper-resistant receptacles in exam rooms could mitigate potential liability in the event of an electrical accident involving a child. Many healthcare facilities and organizations recommend installing tamper-resistant receptacles in all areas where children may be present. The cost of installing tamper-resistant receptacles is relatively minor compared to the potential benefits of preventing electrical injuries. It may also have a minimal impact on the overall design of the clinic. While state regulations may not explicitly require tamper-resistant receptacles in children's health clinics, it is prudent to install them in exam rooms out of an abundance of caution. This decision aligns with best practices, enhances patient safety, and mitigates potential legal risks. The key consideration is protecting children from potential electrical hazards. Tamper-resistant receptacles are designed to prevent the insertion of foreign objects into the electrical slots, which can cause electric shock or other injuries. In areas where children are likely to be present, such as exam rooms, waiting areas, and play areas, tamper-resistant receptacles provide an extra layer of safety. While the National Electrical Code mandates tamper-resistant receptacles in specific locations, such as dwelling units and childcare facilities, the applicability to healthcare settings can vary based on local interpretations and amendments. It's essential to consult with local authorities having jurisdiction and electrical inspectors to determine the specific requirements in your area. Even if not explicitly required by local codes, consider the potential benefits of installing tamper-resistant receptacles as a best practice. They demonstrate a commitment to patient safety and can reduce the risk of electrical accidents involving children. The decision to install tamper-resistant receptacles should be made in consultation with relevant stakeholders, including healthcare professionals, facility managers, and electrical contractors. Weigh the costs and benefits, and consider the potential legal implications of not implementing this safety measure. It is also helpful to review industry standards and guidelines related to electrical safety in healthcare facilities. Organizations such as the National Fire Protection Association, or NFPA, and the Joint Commission may provide recommendations on this topic. When specifying tamper-resistant receptacles, ensure that they meet applicable product safety standards such as those established by Underwriters Laboratories, or all. Look for receptacles that are clearly marked as tamper-resistant and have been tested to prevent the insertion of foreign objects. During installation, follow the manufacturer's instructions and ensure that the receptacles are properly grounded. Regular inspections and maintenance should be performed to ensure that the receptacles are functioning correctly. Staff training is also essential. Healthcare providers and other staff members should be educated about the importance of tamper-resistant receptacles and how they help prevent electrical injuries. They should also be trained to identify and report any damaged or malfunctioning receptacles. Another consideration is the specific needs of the patient population. Some children may have developmental disabilities or other conditions that increase their risk of tampering with electrical outlets. In these cases, additional safety measures such as outlet covers or recessed receptacles may be necessary. Consider the overall design of the exam rooms and other areas where children are present. Minimize the number of exposed electrical outlets and locate them in areas that are less accessible to children. Keep cords and wires out of reach and use cord management devices to prevent tripping hazards. In addition to tamper-resistant receptacles, consider other electrical safety measures such as ground fault circuit interrupters, or GFCIs, in wet locations such as bathrooms and sinks. GFCIs can help protect against electrical shock by quickly cutting off power to a circuit if a ground fault is detected. The decision of whether or not to install tamper-resistant receptacles should be based on a thorough risk assessment, taking into account the specific characteristics of the healthcare facility, the patient population, and the applicable codes and standards. Consulting with a qualified electrical engineer or safety professional can help ensure that all relevant factors are considered. Ultimately, the goal is to create a safe and secure environment for children in healthcare settings. By implementing appropriate electrical safety measures, including the use of tamper-resistant receptacles, healthcare providers can help protect children from potential electrical hazards. It is also helpful to document the decision-making process regarding tamper-resistant receptacles. This documentation can be useful in the event of an electrical accident or other incident. Maintain records of inspections, maintenance, and staff training related to electrical safety. These records can demonstrate a commitment to patient safety and compliance with applicable codes and standards. Remember that electrical codes and standards are constantly evolving. Stay informed about the latest changes and updates to ensure that your facility remains in compliance. Subscribe to industry publications, attend conferences and seminars, and participate in professional organizations to stay up to date on the latest developments in electrical safety. In addition to the technical aspects of tamper-resistant receptacles, consider the human factors. Create a culture of safety in the healthcare facility where everyone is aware of the potential risks and takes steps to prevent accidents. Encourage staff members to report any safety concerns or hazards they identify. Involve patients and families in the safety process. Provide them with information about electrical safety and encourage them to report any concerns. By working together, healthcare providers, staff members, patients, and families can create a safer environment for children. Consider the long-term costs and benefits of installing tamper-resistant receptacles. While the initial cost may be slightly higher than standard receptacles, the long-term benefits of preventing electrical injuries can outweigh the costs. Tamper-resistant receptacles can also reduce the risk of liability and improve the facility's reputation. In some cases, insurance companies may offer discounts for facilities that implement enhanced safety measures such as the installation of tamper-resistant receptacles. Check with your insurance provider to see if any discounts are available. Another factor to consider is the availability of funding for safety improvements. Some grant programs and other funding sources may be available to help healthcare facilities pay for the cost of installing tamper-resistant receptacles and other safety measures. Research available funding opportunities and apply for grants to help offset the costs. When selecting tamper-resistant receptacles, consider the aesthetics of the exam rooms and other areas where they will be installed. Choose receptacles that are compatible with the overall design and decor of the facility. Tamper-resistant receptacles are available in a variety of colors and styles to match any decor. Consider the accessibility of the receptacles for patients and staff members. Ensure that the receptacles are located in areas that are easy to reach and use. Avoid placing receptacles behind furniture or other obstructions. Provide adequate lighting in the areas where receptacles are located. Good lighting can help prevent accidents by making it easier to see the receptacles and any potential hazards. Regularly inspect the receptacles for signs of damage or wear. Replace any damaged or worn receptacles immediately. Use only qualified electrical contractors to install and maintain electrical equipment. Qualified contractors have the training and experience necessary to ensure that the work is done safely and correctly. Keep a record of all electrical work performed in the facility. This record can be useful for tracking maintenance and identifying potential problems. Develop a written electrical safety program for the facility. This program should outline the procedures for inspecting, maintaining, and repairing electrical equipment. The program should also include training for staff members on electrical safety. Review the electrical safety program regularly and update it as needed. Ensure that all staff members are familiar with the program and understand their roles and responsibilities. Consider conducting regular electrical safety audits of the facility. These audits can help identify potential hazards and ensure that the facility is in compliance with applicable codes and standards. Use the results of the audits to make improvements to the electrical safety program. Involve staff members in the electrical safety process. Solicit their feedback and suggestions for improving safety. Recognize and reward staff members who demonstrate a commitment to electrical safety. Make electrical safety a priority in the facility. By creating a culture of safety, you can help prevent electrical accidents and protect patients, staff members, and visitors. The NEC Article 406.12 requires tamper-resistant receptacles in dwelling units and guest rooms of hotels and motels and childcare facilities. The definition of dwelling units includes one-family houses, apartments, and condos. Childcare facilities are locations that provide childcare services. The NEC does not specifically address healthcare facilities. However, Section 90.3 states that the NEC is not intended as a design specification or an instruction manual for untrained persons. It is intended to be used by qualified persons who are trained and experienced in electrical work. Therefore, the NEC is not intended to be a comprehensive safety standard for all electrical installations. Other codes and standards may apply to healthcare facilities. These codes and standards may require tamper-resistant receptacles in certain areas. For example, the NFPA 99 Healthcare Facilities Code may require tamper-resistant receptacles in patient care areas. It is important to consult with the local authority having jurisdiction to determine the specific requirements for your project. The authority having jurisdiction is the organization, office, or individual responsible for enforcing the requirements of a code or standard, or for approving equipment, materials, an installation, or a procedure. The authority having jurisdiction may be a federal, state, local, or other regional department or individual such as a fire marshal, building official, electrical inspector, or others having statutory authority. In addition to the codes and standards, you should also consider the potential liability if a child is injured by an electrical shock in your facility. If you do not install tamper-resistant receptacles, you may be held liable for the injury. Therefore, it is prudent to install tamper-resistant receptacles in all areas accessible to children, even if they are not specifically required by code. The cost of installing tamper-resistant receptacles is relatively minor compared to the potential benefits of preventing electrical injuries. Consider specifying a higher-grade tamper-resistant receptacle. These receptacles are designed to withstand more abuse and are less likely to fail. Also, consider installing outlet covers over unused receptacles. Outlet covers can provide an additional layer of protection against electrical shock. Educate parents and children about the dangers of electricity. Provide them with information on how to prevent electrical shocks. Post warning signs in areas where children are likely to be present. The warning signs should remind people to be careful around electricity. Supervise children closely in areas where electrical hazards are present. Never leave children unattended near electrical outlets or cords. If you are unsure about whether or not to install tamper-resistant receptacles, consult with a qualified electrical contractor or engineer. They can help you assess the risks and determine the best course of action. Electrical safety is a serious matter. Take the necessary precautions to protect children from electrical hazards. The National Electrical Code in Section 210.52, Dwelling Unit Receptacle Outlets, requires in 210.52. That receptacle outlets located in dwelling unit shall be tamper-resistant. Section 517.18. C. Receptacles with insulated ground and hospital grade, that any receptacle installed within the patient care vicinity must be hospital grade. Section 517.2. Definitions. The patient care facility is defined as a space within a location intended for the examination and treatment of patients.